Opioid misuse is one of the greatest threats to our health today. Whether it starts with prescription pain medication or heroin, that's because opioids have such strong effects on our bodies, particularly the brain. Opioids are derived from the poppy plant, or are man-made chemicals with the same effects. Opioids include opium, parts of the poppy plant, morphine, heroin, and prescription pain meds like oxycodone or OxyContin, fentanyl and hydrocodone, also known as Vicodin or Norco. Codeine is an opioid that relieves coughs and diarrhea. Opioids can be injected, smoked, snorted, or swallowed, but injection gives the fastest high. All affect the brain similarly and can be very dangerous, whether or not they're prescribed by a physician. Opioids affect the spinal cord and brain, reducing pain awareness. But they're dangerous because they hijack the brain's reward systems. Opioids affect brain receptors called mu receptors. Here's how it works. The brain has billions of nerve cells that send messages to each other by chemical messengers, called neurotransmitters. When we feel pain or stress, the pituitary gland usually releases neurotransmitters called endorphins. These are natural painkillers. They bind to the mu receptors and cause relaxation and pain relief. Opioids are like endorphins' evil copycat, because they mimic the same effects. But when opioids bind to mu receptors, they fool the brain into thinking that they are extra strong endorphins, causing really intense relaxation and pain relief. Repeated opioid use causes the brain to produce fewer natural endorphins. Opioids flood the brain with another neurotransmitter, dopamine. Normally, dopamine is found in parts of the brain that control movement, emotion, thinking, and pleasure, and it's released after feel-good experiences like a good meal. Opioids activate dopamine receptors all over the brain, causing positive feelings. But repeated opioid use hijacks the dopamine system, flooding the brain with abnormally high levels. Over time, the brain becomes so used to these high dopamine levels that opioids stop producing dopamine naturally, and just wait for more opioids. If no opioids are used, the brain desperately craves opioids and starts to feel depressed. Opioids cause short and long-term effects. The brain feels a surge of euphoria, after which people start to nod off. Pupils become constricted, and snorting opioids causes sniffing or sneezing. Breathing slows, body temperature lowers, and feelings of floating or heavy limbs occur. Opioids also harm the digestive system, causing constipation or diarrhea, cramping, nausea, and vomiting. They also irritate the skin, causing warm sensations, flushed skin, and severe itching, which is usually the most common side effect. Opioids also harm the body over time. It's hard to feel pleasure without the drug, or to think clearly. Good emotions become linked to memories of drug use, so seeing a needle can trigger cravings. The nose and gums can get inflamed and sore. Opioid injection sites can become infected. Blood vessels can clog from drug impurities, and veins can scar or collapse. Opioids also cause irregular heartbeat and increase risks of heart attack and stroke. The immune system often gets weaker, so it's much easier to get sick. Opioid use can cause arthritis, and the kidneys and liver don't work as well as they used to and might eventually fail. Opioids can also cause decreased interest in sex and sexual pleasure. But the most immediate danger is overdose. Opioid overdoses are becoming more and more common because opioids affect heartbeat and breathing. When someone overdoses, their breathing slows and then stops. Signs of overdose include shallow breathing or no breathing, dry mouth, small pupils, blue or white lips, tongue or fingernails, clammy skin, drowsiness, confusion or coma, and low blood pressure or weak pulse. If they get there in time, a first responder, police officer, or bystander can treat someone who is overdosing with a life-saving naloxone injection.